Good evening to all. We can start with a quick review on the Kent, TPB and BBCR. First of all, before starting the class, I'm saying we can have an interaction section, not a one-sided game here. I want the response from you, and I think you will all respond. Okay. First, we can start with the Kent repertory. First, we start with the what is the full name of the Kent repertory. First, if we are starting with the book, we have to first of all try the full name of the book. It is also the purpose of study. Okay. What is the full name of the Kent repertory?
Repertory of homeopathic mathematics.
Homeopathic. Kent's Repertory of Homeopathic Mathematics by James Taylor Kent. Next, TPB. Its full name is? Name of the book? Can you hear me?
Therapeutic pocketbook for homeopathic physicians.
Yes, name of the book is 𝗤𝗂𝗃𝗄𝗃 Therapeutic Pocketbook. Its full name is 𝗤𝗂𝗃𝗄𝗃 Therapeutic Pocketbook for homeopathic physician to use at the bedside in the study of mathematics. Sometimes we have to study this also. So some options will be like this, and we have to identify it. So go through it, the full name. Next, BBCR, the full name is 𝗤𝗂𝗃𝗄𝗃 Characteristic Repertory. Next, we go into the Kent's Repertory's year of publication, which is the first edition in which year?
1897. 1897.
Yes, correct. It is the first edition is in the 1897. You have to first of all by heart that the year it is difficult to study, but in the exam of you we have to by heart certain years and numbers. First edition was published in 1897 and the second was 1910. Third in 1924, fourth in 1935, fifth 1945, sixth 1957, and the seventh edition was published in 1974. And the first Indian edition was published in which year?
1961.
1961. So in the exam, especially in the NAM exam, you have to first of all study these 2 years are important. The first edition, that is 1897, and the first Indian edition, you have to by heart. That is 1961. Also, you remember the 6th edition was published in 1957. As the other repertories like synthesis, synthesis, the source repertory is the 6th American edition of Kent. So be in mind that the 6th edition is 1957. Okay. Next, we go into the BBCR. BBCR introduction. In which year the first edition was published?
1900.
Pardon?
1905.
Yes, the first edition was published in 1905 by Rubric and TOEFL was published this book. And next, the second edition or the Indian edition was published in 1937. 1937. And along with this, you have to go through some points along in the BBCR. That is, the introductory part was written by Dr. 𝗃𝗂𝗃𝗲𝗃. This you can see in the first page of the BBCR book. The introductory part was written by 𝗃𝗂𝗃𝗲𝗃. Okay. Next, the life history was written by T.L. Bradford. Whose life history is mentioned here?
𝗤𝗂𝗃𝗃𝗄𝗃.
Yes, the sketch of life history of the 𝗤𝗂𝗃𝗃 was sketched in the in the introduction of this BBCR book. Okay. Next, there's a correction of abbreviation. It was done by Dr. D.P. Rastogi and Dr. V.D. Sharma. This along 108 abbreviations were corrected by both of them. Next, the preface was written by C.M. Boger. Okay. Medicine index by 𝗃𝗂𝗃𝗲𝗃 and word index by S.P. Roy. Okay. In the NAM exam, you only can want to remember the first edition and the second edition. But this NAM exam is not your first exam. You have to face APAG, MO exam all. So you have to remember this also, okay? I think you are getting my, no problem, no? Is there any problem? You can understand me?
Yes.
Doctor, you can continue.
Okay. Next, we go into the therapeutic pocketbook. It was published in 1846. Okay. Next, we go into the grades. How many grades in the 10 repertory?
3.
3 grades. Which all are there?
Italics, bold.
Bold, italics, and Roman. Okay. Next, TPB and BBCR. How many grades are there?
5
Pardon?
5 gradations.
Yeah, 5 gradations. Capital, bold, italics,
bold.
Roman in parenthesis. Okay. Next, we go into the philosophy of Kent repertory. Kent repertory is based on the deductive logic. That is general to particular. In the exam hall, we will be at a very pressure. So the base will be forgotten by us. So for just for if you want, you can take the Kent repertory. You can remember by DGP. Kent repertory, deductive logic, general to particular. Then you won't remember forgot. Okay. And the TPB and BBCR is from particular to general. In TPB based on the doctrine of analogy and concomitant, and BBCR based on the complete symptom pathological general concomitants. Next, in the BBCR, you also want to remember this fundamental concepts: doctrine of pathological generals, doctrine of causation and time, doctrine of clinical rubrics, doctrine of fever totality, and doctrine of concordance. Just go through it, okay? Next, the source of Kent repertory. Mainly in this, in the exam of point, mainly you remember the 𝗏𝗏𝗄𝗏 repertory. It is more important. So the source book is main, there is the 𝗏𝗏𝗄𝗏 repertory. Okay. Other you just go through. Okay. This is the source book of BBCR. There are so many. Just if you want, you can go through. And in the case of therapeutic pocketbook, there are 3 source books: Repertory of Antipsoric Medicines in 1832. Repertory of medicines which are not antipsoric in 1835, an attempt at showing relative kinship of homeopathic medicine in 1836. Which repertory is considered as a progenitor of all repertories?
Repertory of antipsoric.
Repertory of antipsorics.
Yes, repertory of antipsoric medicine. Important, okay? Next, we go into the chapters. First, we start with the Kent repertory. How many chapters in Kent repertory?
37.
37 chapters. When the urinary system is not divided, it is 33 chapters. Just go through the chapters. Next, in the BBCR, we get 53 chapters. Okay. BPP, the chapter number is not mentioned. The 7 sections you go through. Okay. Next, we go into the arrangement of rubric. What do you know about the Kent's arrangement of rubrics?
STME.
Okay, it is alphabetically arranged. All rubrics and sub-rubrics are arranged in alphabetical order, and also STME, that is site, time, modality, and extension. Okay. Next, we go to the Kent repertory in detail. Which is the largest chapter in the Kent's repertory?
Extremities.
Smallest?
Extremities.
Prostate.
Smallest chapter is?
Hearing.
Page-wise
Hearing.
prostate, rubric-wise.
Smallest chapter in the book, page-wise?
Prostate.
Prostate. The largest chapter is extremities. Okay. And the smallest is the prostate. And lowest number of rubrics is the
Hearing.
hearing. How many? There are 4 rubrics.
4.
And the maximum number of rubrics are present in the mind chapter. Okay. That's around 529 rubrics are there in the mind section. Okay. Next, we go into the total number of medicine. In Kent repertory, how many medicines are mentioned?
642.
642.
With how much?
642.
648 is there. 6 are synonyms. So, but usually when asked, we have to mention it 648. Okay. Next, in the 𝗤𝗂𝗃𝗃𝗀 therapeutic pocket book, in original book, how many medicines are mentioned?
126.
126. Next, in TFLN's edition,
342.
how it become 342?
Added
220 medicines added.
TFLN added 220 medicines and removed 4 medicines.
4 medicines.
You know which all medicines were removed?
Magnetospole.
Angostura.
Yes, yes. You just remember Angostura and 3M is there. Magnetospolus arcticus, australis, and ambo. Okay. Thus, the 342. And in the 𝗤𝗂𝗶𝗲𝗄 edition?
362.
362. Okay. Next, in the BBCR, how many medicines are mentioned?
140.
464.
Total medicines in BBCR. 464. 464 is the right answer. Okay. Next, we go into the concordance section. First, we start with the BTP, our therapeutic pocket book. How many medicines are mentioned in the concordance section of BTP?
148.
141. 141. It is mentioned in 141. Some books it is 142, but in the Tiwari it is mentioned as 141. So you follow that. Okay. Next, in BBCR, how many medicines in the concordance chapter?
125.
125.
125.
Okay. Next, we go into special features. This I give more important. Just you go through the merits and demerits. It's special features of Kent repertory based on the deductive logic. 648 medicines, 3 gradations. Mind, many rubrics and sub-rubrics are mentioned. Generality chapter is large and elaborate. Cross-reference are mentioned. Criticism. Candace advocated the use of bigger general rubrics, but in that rubric, the main medicines were not mentioned. It is one of the criticism. Then criticize BTP, but he also do some main rubrics like a liver, like that, pneumonia, like that rubrics he also mentioned. Then many clinical rubrics which do not serve the purpose of repertorization. Extremity chapter is largest, but least for repertorization. Nosodes are not well mentioned. Single remedy rubrics are many present. This just you go through. Criticism. In the BBCR, you have to go through the in sensation complaints, there's an infant affection of rubric. That rubric you go through, and the sub-rubric also you just read off. Okay. And also the fever chapter, the best, if fever case, it is a BBCR is the best repertory to refer. Okay. Next, some important features. This is a use of repertory. These all where we can see.
First part of.
Yes. It is mentioned the last part last part of the Ken repertory, use of repertory, how to study the repertory. If you get time, just read once. There are so many pages, but just one time you read and mark the important. Some lines only are the important. Just read like that. Okay. In that, there's a repertorizing section. A repertorizing section is there. In that, that section was put forward by the Margaret Tyler and John Weir. Just remind that. Then hot and cold remedies was given by who mentioned? Yes. Gibson-Miller mentioned this. Next, the size of the body and drug affinity was taken from the lesser writing of 𝗤𝗂𝗃𝗿𝗁. And the relationship remedies with duration of action was mentioned by anyone? It is also Gibson-Miller. Okay. Next, we go into the 𝗤𝗂𝗃𝗀's concept of totality. This 7.1 is very important. It is usually asked in every question paper. There will be one. Okay. And it is very difficult to remember also. So you can use, first one is a quiz. It is a personality, the individuality. Just you can remember like that S. Like that only you can remember. If you want, you can follow this. Quiz, that's a personality, the individuality. You can remember that SS and remember that. Next is cute. Cute is a disease, its nature and the peculiarity, DD. Next UB, it's a seat of disease. 𝗂𝗶𝗲 oxalis, you can remember by A. It is 𝗂𝗶𝗲 oxalis, A. So accompanying symptoms. Okay. Next cure, a cause of disease, CC. 𝗂𝗶𝗲𝗄 and 𝗏𝗏. This is usually asked and it will be, some mistake will be usually present. So 𝗂𝗏𝗏, this M is there. So in that you can identify modification or aggravation and emulation. If there is no M, it is a time. Okay. Next, we go to the bedrock of BTP. It's the fourth thing. Doctrine of analogy, doctrine of concomitance, evaluation of remedies, concordance. What is doctrine of analogy? Anyone?
Grand generalization.
Grand generalization. That is, if one symptom is given, sometimes one aggravation by motion. The knee pain is aggravated by motion. According to 𝗤𝗂𝗃𝗀, he said that we can use as a common modality to the whole. Okay. Next is important in the BTP, always asking the division of the back. It is 4 divisions are there: scapula, back in general, cross. Cross is important. Just remind that cross means cross. That is back between the hips corresponding to the region of the sacrum. And 𝗔𝗔 is a region of the coccyx. Okay. Next, there are 2 signs in the BBCR. You notice it? First is the asterisk sign. It is usually asked, it's a paragraph from TPB as altered by Dunham copy. And the plus sign denotes a paragraph from which will help in the selection of similimum. Okay. Next, some of the previous questions. Which one of the following is not a feature of Ken repertory? All the rubrics are arranged alphabetically.
C option.
Rubrics
There
are
are
arranged from
3.
particular. Option C.
Which one?
Rubrics are arranged from particular to general.
In Ken repertory, rubrics are arranged from
General to particular.
general to particular. So the merits and demerits sometimes like this may be asked. So you just go through. Okay. Next, the rubric for Parkinsonism. Boric repertory, the Parkinsonism was mentioned in which chapter?
Nervous system.
Yeah. Yes. Boric repertory, it is mentioned in the nervous system. Next, in Murphy,
Clinical.
we can get in the clinical. Okay. Next, in the synthesis,
Generality.
it is not generalities. It is mentioned as generals. As in the question paper, it is generalities. I mentioned like that. In synthesis, the chapter is generals. Okay.
Okay.
And the BBCR, we can see the Parkinsonism, sensation and complaints. Okay. Next, we go to some rubrics. You can answer it. Before that, it is a request from me. Before you have the repertory, the BTP is a small book. So if you by heart the mind chapter and intellect chapter, it will be very easy to identify the where the symptoms come. So for you to help, helping you, I just mentioned in the alphabetical order. There are almost 17 rubrics here. So first you start with the A. So there are 5 rubrics in the mind chapter. Absence of mind, alternative mood, amativeness, anxiety, average. 5 other in A. Okay. Next is a B. B is boldness. There is no C in the mind chapter of starting with C. So avoid that. Then D for despair. E for excitement. F for fretfulness. These are all orders. A, B, C is not there. D, E, F. You can see the slide, no?
Yes.
Yes. Okay. G for gentleness. H for haughtiness. Indifference. J. Till J, that's in alphabetic order. So you can remember like that. Okay. Then there's M. Two rubrics are there, mischievousness and mistrust. And also in last S, sadness and seriousness. Just go through this. If you read 10 minutes daily, on the 5th, 6th day, you will by heart. That's sure. Okay. So try it, okay? Next, also in the intellect chapter, that's also in somehow in the alphabetic, you start with the activity. Okay, in the mind, there are five rubrics with A. In the intellect, only 1, activity. Then befogged. C, there is 3, comprehension difficult, comprehension difficult and easy. Then confusion. Then E for ecstasy. D is not there in this. Okay. Then I, imagination, there are 4. These are usual questions in the every exams. Anyway, so please by heart or you have to read daily. It will be remembered. Okay. Imagination, imbecility, impaired, insanity. Then memory, with starting with M3, memory active, lost and weak. And last SUV. Remember like that. Stupefaction, unconsciousness, vertigo. Okay. So you can answer this in the BTP. First, we can start with the BTP. Impaired, where we get
Intellect.
it will be easy if you study like that. Okay. Beard.
External.
External.
Beard.
External head.
Yes. Impaired beard, we can get in the external head. Paralysis of optic nerve.
Vision.
Vision. Then eye teeth.
Teeth.
Teeth. Okay. Then desires and aversion in BTP.
Angaran test.
This desires and aversion you have to by heart. In each book it is different. In BBCR where we get
Appetite.
yes, appetite. And then Kent.
Stomach.
Okay. Next Burns where we get in BTP.
Sensation.
Burns are in 2 places.
Aggravation.
And also, okay. Next, coat of skin drawn over the inner part, sensation of.
Aggravation.
No.
Sensation.
Yeah, it can be get in the sensation. Next, dislocation.
Sensation.
Disordered stomach.
Aggravation.
Aggravation.
Aggravation. Then abortion.
Menstruation.
Menstruation. Okay. Next, we go into the BBCR. There are many misplaced and confusing rubrics in the BBCR. For exam point of view, it is better to learn more Kent and BTP. It is more helpful and you will remember more. And if you have time, try to study this rubrics. Okay. Confused, we will get in the BBCR.
Mind.
Confused?
Mind.
Yes, mind. Confusion?
Sensory.
Sensorium.
Sensorium, yeah. These two rubrics are similar, but it is in 2 chapters. Then sunstroke.
Head.
Internal or external?
Internal.
Internal.
Yes, head internal. Then hair falling out, beard. Hair falling out, beard. In BBCR.
Skin.
Head external. Head external, you can get this rubric, hair falling out, beard. Then desires and aversion.
Appetite.
Appetite. Okay, appetite. Then qualmishness. These are usual questions. Okay.
Nausea and vomiting.
Nausea and vomiting. Yes, nausea and vomiting. We get the qualmishness. Then cold breath.
Mouth.
Respiration.
In BBCR, cold breath.
Respiration.
Hot breath.
Respiration.
Okay.
Respiration.
Respiration. Yeah. In BBCR, you study like this. Cold breath and hot breath both we can get in the respiration chapter. In Kent, cold breath is in
Mouth.
mouth. Hot breath.
Respiration.
Just thing like that. From in Kent repertory, when we get in the mouth, there'll be cold air, and in the respiration, hot air. Like that, you remember. And in BBCR, where we can see this cold breath. Therapeutic pocket book. Go.
Respiration.
Cold breath.
Mouth.
Hot breath. Both are in the mouth. In the therapeutic pocket book. In BBCR, both are in the respiration. In BTP or therapeutic pocket book, both are in the mouth. And in Kent, cold breath is in the mouth and the hot breath in the respiration. Okay? You get it? Okay?
Yes.
Yes.
Next is a torticollis. Where we get?
Throat.
Neck and external throat.
Neck and external throat. And the rubric is? What is the rubric there? Torticollis?
Rhinic.
Yeah, it's a rhinic. In Kent, where we get?
External throat. External throat.
Okay. Then 𝗂𝗂𝗃𝗿𝗂. It is in the lower extremities. Okay. Next, we go into the Kent repertory. Only some rubrics I mentioned here. Astigmatism. In Kent repertory, where we will get? Eyes. Okay. Fade away, then reappear objects. Where will we get?
Vision.
This is a usual question. Remember that, okay. Where? Vision, yes. Fade away, then reappear object. It is in the vision. Torticollis, already mentioned.
External throat.
External throat. Then desires and aversion.
Stomach.
Okay. Then worms, where we'll get?
Rectum.
In Borneo's therapeutic book, where we'll get the worms?
Stool.
Stool.
so many rectum, all we get in the stool. Next, abortion, the stool rubric. It came in the same line. Abortion, one. In which chapter
Female
you get?
genital. Female genital.
Female
Female.
genital. Then awkwardness.
Mind.
Mind.
Awkwardness.
Extremities.
It is in
Extremity.
extremities.
Extremities.
In BBCR, we will get.
Mind.
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 Then collocative.
Fever. Perspiration.
Collocative.
Perspiration.
Initial question.
Perspiration.
Perspiration. We will get in the perspiration chapter. Just go through this before you lie down, okay? Then tendon injuries.
No.
We will get tendon injuries.
Extremities.
In repertory.
Generalities.
Tendon injuries.
Generality.
Yeah, it is in the generalities chapter. Okay. And burns.
Generalities.
Generalities. Yeah.
Generalities.
Generalities section. Okay, I will ask some rubrics. You have to answer it, okay? You have BTP with 𝗤𝗂𝗃𝗏𝗄 and therapeutic book with you? Do you have?
Yes.
Do you have the book with you?
Yes.
Yeah, then I will ask some questions. Eyes protruding, where we can see.
Face.
Therapeutic pocket book.
Face. Face.
Yes, face. Just mark or you write this rubrics, okay? Then roundworms, all the worms you can see in the stool chapter, okay? Hemorrhoids, rectum, perineum, all you can see in the stool chapter of the BTP, okay? Stool chapter. Then in diabetes mellitus, in the rubric in BTP.
Glycosuria. Urine.
Urine.
Urine glycosuria.
Then repertory.
Urine sugar.
Urine sugar.
Then one more is there.
Generalities. Generalities.
Specific gravity increased.
Specific gravity increased.
Yes. And then in BBCR, we will get
Urine saccharine.
urine saccharine. Okay. Ringworm, where we can get in BTP.
Stool.
Ringworms.
Skin.
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 Skin eruption. Yes.
Skin tetters ringworm. That's a rubric. Okay. Tonsils.
Throat.
Throat.
Yes. Throat, we can get the tonsils. Okay. Vertigo.
Intellect.
Vertigo.
Intellect.
Okay. Then nails and all we will get were nails.
Skin.
Skin.
Extremities.
Upper
In
extremities.
BTP, 𝗤𝗂𝗃𝗏𝗄 and therapeutic book, where we'll get the nails.
Upper extremities.
Skin.
A chapter like that in the
Skin. Skin.
The skin, nails, affection. Okay. Then cracking of joints. Where?
Sensation.
Sensation.
It is in sensation. Okay. Then always asking question, inguinal rings in therapeutic pocketbook.
Internal abdomen.
Internal abdomen.
Internal or
Internal
external?
abdomen.
Internal abdomen.
Abdomen.
Internal abdomen. Okay. Then pit of the stomach.
Internal
External
abdomen.
abdomen.
External abdomen.
It is in the external. In external abdomen, there are 3 rubrics. You can remember like that. Pits of stomach is important. Mons veneris is important, and also inguinal gland. Inguinal ring is in the internal abdomen, and inguinal gland is in the external abdomen. Okay. Illusion of colors. Illusion of colors where we get
Vision.
Sensation.
illusion of colors.
Sensation.
Vision.
It is in the vision. Illusion of colors. Vision. In BTP, I'm saying, okay. Then where we get the arsenic poison, like arsenic fumes.
Aggravation.
Aggravation.
Yes, in aggravation. Next, somnambulism in therapeutic pocketbook.
Sleep.
Which one?
Sleep.
Yes,
Sleep.
it is in the sleep, and in Kent, where we'll get somnambulism.
Mind.
Mind.
BBCR. BBCR, where we can get somnambulism. It is also in the mind. In Kent and BBCR, it is in the mind, but in the BTP, it is in the sleep. Okay. Then cataract. Cataracts.
Eye lens.
Eye lens.
Yes, in BTP, it is eye lens. Next in the Kent, where we'll get
Eye.
eyes, cataract.
Cataract.
Then BBCR,
Vision.
eye,
Vision.
vision, cataract. Okay. Anthrax, we will get in the Kent repertory. Anthrax.
Extremities. General.
Anthrax. It is in the extremities. Okay. Next, a few rubrics from the Kent repertory. Grimaces, where we can get grimaces. What is grimaces? What is grimaces? It is a facial expression of suffering. Okay. So where we'll get in the Kent repertory?
Face.
Mind we can
Face.
get it. Okay. No, mind. In Kent repertory, we can get it in the mind. Okay, mind chapter. Detachment of retina. In Kent repertory, I'm saying, okay. Detachment of retina. Where we can get?
Eyes. Eye.
Eyes. Okay. Next, lockjaw.
Face.
Hmm?
Face.
Face. In the parotid gland, where we can get parotid gland. It's a usual.
Face.
Where?
Face.
Okay. BTP. I mean, therapeutic pocketbook.
Yes.
Years. It's a
Years.
misplaced rubric there, okay? Goiter.
External
External throat.
Goiter in the
external throat.
external throat. Okay, next, heartburn.
Stomach.
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 Stomach. Okay. Then spleen, inflammation of the spleen, all like that. Same appendicitis and all. We can see where
Abdomen.
Abdomen.
Abdomen. Abdomen.
the rubric is abdomen.
Inflammation.
Abdomen inflammation. There are so many rubrics under that. Appendicitis, liver, pancreas, spleen, all are mentioned there. So please go through it. Okay. Next, abscess just below the coccyx, where we will get in the Ken repertory. Abscess just
Rectum.
below the coccyx.
Rectum.
Where? Yeah, yes, rectum. The first rubric in the rectum chapter. Okay, it is a usual question. Abscess just below the coccyx. Okay. Addison's disease.
Kidney.
Generalities.
Addison's disease.
Kidney.
It
Kidney.
is in the kidney chapter. Also, one more rubric is important. Suppression of urine. It is a usual question. Both are usual question. Addison's disease and suppression of urine. Okay. Abortion, what will get? Abortion,
Female genitalia.
Genitalia.
female genitalia. Abortion, excitement. There's only a single medicine mentioned. It is a usual question. Sometime may be asked. So only one medicine is mentioned there. It is 𝗔𝗂𝗵𝗔. Okay. Next, hydrocele. Where we'll get hydrocele.
Male genitalia.
Genitalia. Genitalia.
Male.
Then hydrocele and varicocele in the genitalia. Okay. Next, angina pectoris.
Chest.
Chest.
Where?
Chest.
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 Next also there are some rubrics. Aneurysm of heart, angina pectoris, deformed nipple. Nipple complaints will be, mammoth complaints will be in the chest, in Ken's repertory. Just remember like that. Murmurs. Murmurs is important rubric. Okay. It is in the chest chapter. Okay. Then bifida. We will get bifida.
Back.
Back.
Yes, back. There's also other rubric, injuries of spine, opisthotonus, all we can get in the back chapter. Okay. Next, the caries of bone. Caries of bone. Where?
Extremities.
Where?
Generalities.
Generalities.
Generalities or extremities?
Extremities.
It is in the extremities. It is a usual question. Caries of bones. It is in the extremities chapter. Okay. Ganglia. Ganglia.
Skin.
Skin ganglia. Then semi-conscious hears everything. We will get the rubric.
Sleep.
Pardon?
Sleep.
Which one? Semi-conscious hears everything. It is in the sleep chapter. Sleep. It's also important. Semi-conscious hears everything. Okay. Next, we can go some rubric, some of the rubric in the BBCR, important rubrics only. Where we can get aphasia in BBCR, 𝗤𝗂𝗶𝗲𝗀 therapeutic pocketbook.
Mind.
It is in the mind. Okay. Then confused. Confused in
Mind.
Mind.
sensorium.
Confusion.
Confused in mind and confusion in sensorium. Okay. Desires and aversion in? Desires and aversion?
Appetite.
Appetite.
Hiccup.
Irritation.
Hiccup.
Irritation.
No, it is a separate chapter in BBCR. Okay. Hiccup. Hemorrhoids. In BBCR, we will get hemorrhoids.
Anus and rectum.
Anus and rectum. Yes. Cold breath and hot breath.
Respiration.
Respiration.
Respiration. Okay. Hydrothorax. Hydrothorax.
Sensational complaints.
No, it is in the chest inner. Chest inner. Okay. Hydrothorax. That's pleurisy, pneumonia. All we can get in the chest inner. Okay. Chest inner, hydrothorax, pleurisy, pneumonia. All we can get in this chapter. Okay. Thyroid gland. Thyroid gland. Where we get the rhinic or torticollis?
External throat.
External throat.
Neck and external throat. In the same chapter, we can get the thyroid gland. Okay. Learning slow to walk. Learning slow to walk.
Extremities.
Mind.
BBCR.
Mind.
Learning slow to
Sensation and
walk.
concordance.
Where? We can get in the lower extremities. That's an important rubric. Walking it is under the walking. Walking, learning, slow in. 3 rubrics are there. Walking backward, walking difficult, fall easily. These are 3 rubrics mentioned in the rubric walking. It is important. Okay.